Cavernous sinus syndrome review. Cavernous sinus syndrome, we have to start first to know what structure inside this cavernous sinus. You will find this is the internal carotid artery, some cranial nerve, optic, oculomotor, trochlear, abducens, and the ophthalmic and maxillary division of the trigeminal, and the sympathetic nervous plexus. So what's the etiology of this syndrome? Etiology can be due to septic causes or aseptic causes. Septic causes usually spreading of an infection from nasal frontal or synovial or ethmoidal sinuses or even dental infection. While the aseptic cavernous sinus thrombosis can be happen due to nasopharyngeal cancer or other tumor in the small base of the skull. The patient presented by headache, which usually sharp located behind or around the eye and progressively getting worse. The patient can be presented by diplopia, visual loss, painful ophthalmoplegia, proptosis, pulsating ophthalmos, sensory loss, especially in the ophthalmic and maxillary division, and sometimes loss of corneal reflex, and apsilateral oculomotor abducent trochlear cranial nerve palsy. There is another way to remind the clinical picture by reminding the affecting structure inside the cavernous sinus. For example, if it's affecting the optic nerve, the patient will be presented by visual loss. It's affecting the oculomotor abducent and trochlear, it will be patient represented by diplopia and painful ophthalmoplegia, sure monocular diplopia. If it's affecting the trigeminal, it will be presented by abnormal face sensation on the ophthalmic and maxillary division distribution. It's affecting the cavernous internal carotid artery, it will be presented by pulsating exophthalmos. When it came, the usual oral question is if it's cavernous sinus thrombosis or orbital apex syndrome. Actually, the two syndrome is typical to each other, but in orbital apex syndrome, it's additional, there is apsilateral optic nerve involvement as well. That's why reduce of the visual acuity and reduce of the color vision, and also the relevant afferent papillary defect will be presented with the orbital apex syndrome. Complication, sure, visual problems and blood clots, which usually may be due to a disease which is making these blood clots. That's why the patient will present in another places, clots in another places, which usually very serious and can be fatal. So the treatment will be in form of admission and giving IV fluid and sedation. The main line of treatment is to giving antibiotic. So the antibiotic is the main treatment for the cavernous sinus thrombosis. You can give penicillinase resistant penicillin plus third or fourth generation cephalosporin. In dental infection, usually the anaerobes infection is the main and you have to coverage. And IV antibiotic should be recommended and started within 3 or 4 hours and continued for a long time. Then surgical drainage or giving anticoagulant and giving corticosteroid as a part of reducing the spreading of the clots and as a part of reducing the inflammation and swelling of the body as well.